Development Goal Indicators, Bridging Data and Outcomes, with a focus on the Western Pacific region. A warm welcome to you all, and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome our guests today, whom I will shortly introduce. My name is Chris John. I am FIP Lead for Evidence and Impact Digital Event Programme this year, and I'm also the FIP Lead for Data and Intelligence, as well as being the Secretary of the FIP Data and Intelligence Commission. We move to the next slide, please. Just a few announcements before we get going in earnest. This webinar is being recorded and live streamed via YouTube. The recording, as with all our recordings, will be available on our website at www.events.fip.org. Please do ask questions using the question box provided during the event, and we will endeavour to get those answered. And you're also welcome to provide feedback on any of our events via webinars@fip.org. We would also recommend becoming a member of FIP, and you can do that if you aren't already at www.fip.org membership registration. Today's programme for you is the last in a series of events on evidence and impact that have been running from May this year, and as I said, a focus on Western Pacific. I'll be introducing the events and laying the ground before Dr. Lina Bader will be taking over to talk about the FIP development goals, the regional and national priorities. And then we've got Dr. Sherly Meilianti and Diala Koudmani talking about development and use of indicators to track progress with the FIP development goals. And then I'm delighted to say we can welcome colleagues from the Western Pacific region who will be providing some expertise and insights from the region. So we have Suzanne, Caliph, Leonila, Ocampo and John Jackson joining us. And then we'll finish off with a summary and conclusions at the end of the event. The aim of today's event is to describe how progress towards the development goals can be measured and how indicators have been developed. We'll discuss approaches to monitoring and evaluating global progress towards the FIP development goals. The objectives are to outline why a needs-based data-driven culture is important, to identify approaches, as I've said, to measuring progress towards the development goals, which all link to universal health coverage, describe FIP development goal priorities and how indicators were developed, and to explain how monitoring and evaluation of development goals contributes to evidence of outcomes and impact. The FIP development goals were launched by FIP back in September 2020. They're a key resource for transforming the pharmacy profession over the next decade, globally, regionally, and nationally. They align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And they are set to transform pharmacy in alignment with wider global imperatives underpinning the UN Sustainable Development Goals. So they all map to the health-related UN Sustainable Development Goals, and monitoring the development goals will monitor progress towards those development goals, as well as monitoring progress towards universal health coverage, because they're all mapped and aligned. The evidence and impact events we've been running, and this is one of them, all linked to two particular development goals, 11 and 12. 11 is on impacts and outcomes, and 12 is on pharmacy intelligence. So impact and outcomes development goal, like all the development goals, splits into elements. There's a workforce and education element, a practice element, and a science element. So the workforce element is about having evidence of the impact of the pharmaceutical workforce within health systems. The practice element is about having evidence and impact of pharmaceutical services. And the science element is having strategies and programs in place to enable timely access to safe, effective, and affordable medical products. So the link to the pharmacy intelligence development goal is really about, with the workforce element, having a national strategy and corresponding actions to collate and share workforce data. The practice element is about having a comprehensive national strategy to collect, share, and utilize intelligence on service provision. And then the science element is really about having data-driven decision strategies to accelerate pharmaceutical research, development, manufacturing, and market approval of medical products. The FIP Global Pharmaceutical Observatory is the engine of global pharmaceutical data collection. The FIP GPO is measuring and monitoring progress towards the development goals. And the FIP Global Pharmaceutical Observatory's mission centers around data, intelligence, advocacy, and reporting. We know from the pandemic the importance of data and for data to provide us with evidence which demonstrates impact. So our first task is to collate valid global data on workforce, education, practice, and pharmaceutical science. And we must undertake comprehensive analysis of collated data to provide accessible, high quality intelligence. And all this must be communicated innovatively to promote our member organizations' impact on health. This is communicated via our FIP Atlas, which is our visualization platform for displaying our data and intelligence across the globe. And finally, we will produce evidence-based strategic information, reports, and guidance on the application of pharmaceutical science policies, practices, and services. You'll see that the GPO, as we call it, has a program of work, and first and foremost amongst that work is our multinational needs assessment program, where we take a tried and tested needs-based approach to addressing data and development goal challenges through various projects. And one big project we've had that we've completed earlier in the year was about the pharmacist's role in booster vaccinations, and that the data we collated from that project identified really those nations that have introduced those services, those that haven't, and really provides data for advocating for an expansion of the pharmacist's role in that area. I mentioned the FIP GPO Atlas is a platform for showcasing our members' needs and priorities, supported by data from the GPO. And this allows us to identify opportunities for developing pharmacy with, for, and through our member organizations. The GPO database is the repository for FIP's pharmacy and pharmaceutical science data. It contains data that informs the indicators that we use to track progress against the FIP development goals. And the FIP development goals provide the framework for needs assessments and prioritization for member organizations to undertake relevant to their national situation. And we will be focusing in on regional and national situation in Western Pacific a bit later on. In turn, the priorities can provide each organization with the foundations for mapping the progress and transformations for their workforce, practice, and pharmaceutical science. I'll talk about indicators a bit more in a moment, but they will be a way to measure and monitor progress and transformations for these elements within the development goals, workforce, practice, and science. And as I say, via the data we collect via the GPO. This event that we have today is part of our GPO Data and Intelligence Digital Events Program. And another key part of the work of the GPO is the Data and Intelligence Commission, which I'll now talk about briefly some of the recommendations the Commission has made, which are very much important to developing a needs-based data-driven culture. The Commission provides strategic advice to FIP on the advocacy and delivery of the GPO program, and the Commission made 8 recommendations recently over the summer, which have been accepted actually by FIP Bureau as steps to the development of a needs-based data-driven culture. So really, briefly, the 8 recommendations are: FIP should develop common and accessible guidance and terminology on data collection, processing, synthesis, and analysis. FIP should adopt and adapt for the pharmacy and pharmaceutical science of the World Health Organization's data principles. So Some of the principles apply as they stand, such as data as a public good, being a responsible data steward. Others we've adapted so they fit pharmacy and pharmaceutical science. The third recommendation here was that FIP should consider what it can offer to member organizations as added value to their membership with respect to data. Number 4 was that FIP should serve as a global resource for collecting and disseminating best data practices and successes. Number 5 was about digital health, population health management, and data literacy, and learning outcomes being incorporated into pharmacy initial education and training and post-registration competency frameworks. Number 6 was FIP should continue to advocate for pharmacy to have full access and writability to patient electronic health records. We know there is some variability with that across the globe. And that in number 7, the FIP GPO should develop a clear and transparent governance process to enable data sharing between member organizations. And finally, that each FIP structure, constituency, and forum should identify a data champion who will be supported by the GPO team. So it's very important with developing a needs-based data-driven culture that we have the leaders that can enable that to happen. On the next slide, you'll see the reason why we're here today is about the FIP development goal indicators. I mentioned the FIP development goals breaking into 3 elements: workforce, practice, and science. But then under that, we have the mechanisms and tools and structures to facilitate and support the process of transformation. And then the foundation of the pyramid that you'll see on the screen now is the indicators that measure and monitor the progress of the development goals. And the indicators will be used to support member organizations and nations to identify where improvements are needed, to set priorities for quality improvement and support, to create national dashboards displaying data against priority development goals, to benchmark performance against international data, to support national quality improvement schemes, and to demonstrate progress that pharmacy is making in support of health systems outcomes and indeed universal health coverage. So that's a brief introduction to our work with the GPO and the indicators. It now gives me great pleasure to welcome Dr. Lina Bader, who is the FIP Lead for Equity, Sustainability, Policy and Development. And Lina's been leading the FIP Development Goals Programme of Work. So I'll hand the floor over to Lina. Thank you so much.
Thank you so much, Chris, for that introduction, but also for helping set a lot of the context that will really frame what I'm about to speak about. Thank you so much. It's a pleasure to be here today. And today I'll just be focusing on sharing with you how we've identified national priorities through our member organizations and what that means for the Western Pacific region, which is the focus of the discussion today. So the next slide really summarizes what today is about in terms of my piece. It's about identifying global, national, and regional priorities. I'll start by giving a snapshot of how we've done this, what the global results tell us about priorities using the goals as a framework, then go down into national and regional. That will hopefully also help frame the discussion with our panelists later on today. The next slide really reminds everyone, if you're not already aware, of the report we published last year in 2021, and I know my colleagues will drop in the URL link to this. You'll find this report on the developmentgoals.fip.org website. This is the Setting Goals for the Decade Ahead report, which has been the result of many months of regional engagement and needs assessment and prioritization exercises with our members throughout the months following the launch of the goals. This has resulted in this global, let's say, roadmap and regional and national roadmaps as well using the goals. So feel free to have a look at this report if you'd like an in-depth overview of priorities across all the regions of the world. But of course, specifically more detail about the Western Pacific region. I'll give a very high level summary of those today. The next slide provide some context for this report. As I've mentioned, we've started this work immediately following the launch of the development goals. And the day we launched the goals, we also said, FIP said that we commit to supporting our members to identify the needs using these goals. So we immediately set to action on this. We have done the assessment across the 6 regions of the world: Africa, Americas, Eastern Mediterranean, Europe, Southeast Asia, and last but not least, Western Pacific. And today's event focuses on that last of those regions. I'd like to tell you about how we've done this. So if we go to the next slide, that summarizes our regional engagement strategy, which has resulted in the data collection we needed for this report. So we started in 2021, soon after the launch of the goals in late 2020. In April, we started with conducting high-level meetings with some member organizations, and we ran our first set of regional engagement meetings following the COVID-19 pandemic, which had, of course, accelerated our virtual engagement strategy with our members. So we did the first set in April, then in the summer between July and September, ran the second set of 6 regional engagement meetings with all our members. We continued in October with some more in-depth member interviews to better understand their needs and how we can support them. And finally, in November of that year, we ran the third set of regional engagement meetings with the 6 regions of the world. We continue our regional engagement strategy to this day, and this will continue to be part of our engagement strategy in general with our members. We, of course, also acknowledge that needs change over time. So this will be a continuous process of not only identifying the needs of more members who haven't engaged in the first time, but also reviewing the needs that have been identified by the members who are already engaged, because we acknowledge they may change. The next slide really provides a global summary. So you'll see this really colorful bar chart here showing the goals on one axis and the number of members who have told us that they are that this set goal is a priority for them. And this is represented by region as well. So you'll see, of course, unsurprisingly, that there is variation. Some goals are more of a priority by more members than others, and some are by less members than others. And you'll see some of the highest bars on that chart represent those goals that are more common as priorities around the world, such as goal number 7, advancing integrated services, goal 13, policy development. We have 15, people-centered care, and the ones toward the end here on the slide, patient safety, digital health, sustainability in pharmacy. These are really some of the most commonly identified priorities. So, you know, I ask you to think about how does this link to what you think are priorities for your country. In the next slide is just another way to represent the same results. So in a more maybe digestible way. So we've divided these goals based on frequency by which they were identified as a priority into 3 levels. And it's just important for me to iterate, this doesn't mean that the 3rd level priority goals are not important. They just, within 2021, we had more important ones according to national needs. So these are the 1st level priority goals, which I've just listed and named in the bar chart before. Academic capacity, advanced specialist development are also part of those. The 2nd level priority goals focus on some of the other ones. The icons may be a bit small, so I'll just run through them very quickly. Goal number 2, early career and training strategy. Goal 3, quality assurance. We have competency development, working with others, continuing professional development, medicines expertise, communicable diseases, and access to medicines, devices, and services. So these were some of the 2nd level priority goals. And of course, the 3rd level priority goals are the remaining of the 21 goals. You can have a more detailed overview of these and how we've analyzed this in the report. Now, let's look at the region, the Western Pacific region. So we've actually had quite a high number of responses. We've engaged with 10 member organizations who have participated in the regional engagement and have provided us with their needs. So this we have 10 member organizations spanning 8 countries and territories. Let's have a look at the results. So the next slide shows a similar pyramid, which we've just shown you, but this pertains only to the Western Pacific region and the countries who have responded from that. So you'll see here the 1st level priority goals. There is quite a lot of overlap with the global priorities specific to this region. So the first level priority goals, we see number 1, 4, 7, and 19 and 20 are already part of the global ones. And in addition, we have academic capacity. We have number 2, early career training strategy. Number 4, advanced and specialist development. And number 12, pharmacy intelligence, in addition to some of the common ones. So you'll see that, so there's some, maybe more of a focus on workforce development being identified as a priority. And we have the second and third level priority goals. Again, you can view those in more detail in the report. I'd like to quickly show you, and again, it's better to see them in the report at your own time, but the next slide shows the, first of all, which member organizations have responded. We've had 8 countries and territories, including Australia, China, and you see here which goals they've identified in priority. And the second slide shows the other territories, including China, Taiwan, Japan, Republic of Korea, Malaysia, New Zealand, Singapore. So there is some variation, but again, the aggregation of the data only helps us to find an easy way to digest the information and work on a regional level. It's really important for us to work with our regions, and we appreciate, of course, the leadership of the Regional Forum of the Western Pacific specifically. And I want to just end this by reiterating that FIP will continue to support our members everywhere around the world with needs assessment, prioritization, but also implementation and transformation. We will engage with the member organizations who haven't necessarily engaged with us the first time. We want to build on the data and expand the range of it. And we will make sure that we collect case studies from member organizations and ensure that they are available as shared lessons with the others. This is our commitment from day one, and we continue to deliver on that. And we rely on your support for this. Thank you so much. Chris, back to you.
Thank you so much, Lina, and for taking us from the global level, drilling down right into the regional and national levels as far as development goal priorities are concerned. Please do ask any questions by using the Q&A box on your screen, and we will endeavour to answer them. I'm now pleased to welcome our next speakers, who are a double act from the Global Pharmaceutical Observatory team. Firstly, Dr. Sherly Meilianti, who is our FIP Data and Intelligence Specialist. And I'm also pleased to welcome Diala Koudmani, who is our FIP-UCL Collaborating Centre researcher, who's done a great deal of research on developing the indicators that they'll be talking to you about right now. So please take the floor, Sherly and Diala.
Thank you, Chris, for the introduction. Good day, everyone. It is a pleasure for me to be here. In the initial slide, Chris showed us a pyramid of FIP development goals. And we remember that the third layer of the pyramid is basically a mechanism layer, which is about a growing set of global tools, structure, and programs which are available to facilitate and support the process of transformation toward the FIP development goals. And in the coming slide, my colleagues, Diala and I, will focus on the last layers, which is about indicator. And that would be what we will focus together. So as what you have heard as well from Dr. Lina initially, that during these past 2 years, we engaged with our members around the world. We supported them in identifying and mapping their needs on national and regional level, aligned with the FIP development goals. And Lina already presented the priorities of our member organizations in our previous slide. So using the development goals as a framework, we were able to answer the questions of what is the pharmaceutical development needs to meet national or global healthcare requirement. And since it is used as a needs assessment, now it is time for us to monitor it. So how we can monitor our progress towards the goal. And this is where the indicator is important. What we have done to develop the indicators, and that is why I would like now to hand over to my colleagues, Diala, to give you an overview about the development of the development goals indicators. Diala, the floor is yours.
Thank you, Chris, and thank you, Sherly, for this introduction, and thank you all for joining us today at this event. So I will start now by giving a brief overview of the project, highlighting the different data collection and analysis method used throughout the development process of the Global FIP Development Goals indicators. So as you can see here on the slide, the process involved conducting a series of qualitative research methods, including a desktop literature review, followed by a Delphi method. And this was stage 1 of the project. Later, a quantitative online questionnaire was also incorporated into the second stage of the global engagement, or the second stage, or we also call it the global engagement stage. And I think many of our today attendees are familiar with this questionnaire image presented here on the slide and answering this questionnaire. So I would like here to thank you all for your valuable contribution. For the analysis, also qualitative and quantitative analysis methods were performed to analyze both stages in order to develop the final presented list of global FIP development goals indicators, as we can see here on the slide. Next slide, please, Sherly. Okay. In this slide, I will go into more detail about the methodology and the data collection process. So as I mentioned in my previous slide, a mixed method research design was used, qualitative and quantitative. And the aim of the first stage, stage 1, or the qualitative stage, was to identify the initial draft list of global FIP development goals indicators. Therefore, the development of proposed indicators involved first a content analysis of the relevant documents and the existing data collated from global published reports and surveys by WHO and the FIP. And this was followed by a Delphi method to identify and develop the potential indicators aligned to the 21 development goals, or mapped to the 21 development goals. The aim of the Delphi method was to reach an initial consensus on the proposed list of indicators assigned by an expert group, and this led to the development of 21 unvalidated proposed list of indicators covering different aspects of each DG and ready to use in the next stage. Subsequently, in stage 2, or the quantitative stage, the aim of this stage was to construct the validity of the proposed and validated development goals indicators produced from the previous stage in terms of the indicators' relevancy and availability or accessibility from a global perspective. So the outcome of the Delphi method, the 21 developed list, were presented for wider engagement and used to conduct a global cross-sectional online questionnaire to assess and validate the relevancy and availability of the 21 proposed list of indicators. The 21 questionnaire links were disseminated during a series of FIP digital events held in 2021. One event was held for each development goal, where the attendees of each DG event, who were pharmacists, international pharmacists working across different sectors and career stages, participated in this short questionnaire. Also, a follow-up email or an invitation email was sent to global pharmacy leaders who represent their professional leadership association to participate also in this questionnaire through the FIP different sections. Next slide, please, Sherly. So this slide shows the analysis and main outcomes of stage 1. As I mentioned, a content analysis approach was undertaken to draft the primary pharmacy core indicators, and the output was the development of the GPO core indicators handbook, comprising a list of 127 pharmacy-related core indicators. And this handbook list was used as the input for the Delphi process. Afterward, an expert group of international pharmacists volunteered to contribute in an anonymous 2-round Delphi method, and they were asked to assign the relevancy of indicators listed in the GPO indicators handbook and the published FIP development goals mechanism against each of the DG. The expert group was also asked to provide further review and feedback on the output of the first round. Eventually, after amending and incorporating all expert group comments, an initial consensus was met, and 21 proposed list of 165 unvalidated indicators were developed and aligned in alignment with the 21 development goals. Then the output of the Delphi method was formatted into a questionnaire to be used for the global engagement stage. Moving on to the descriptive analysis for stage 2, the online questionnaire or the global engagement stage, a total of 755 participants responded to the online questionnaire from different practice areas and the 6 WHO regions. So as we can see here on the map, that the Western Pacific and the European regions were the regions with the highest response rate, with 31% and 20 or around 23% respectively. And the responses from the other four regions were nearly evenly distributed, ranging from 10 to 12% of the total response rate each. Next slide, please, Shirley. So this is a bit of a heavy slide and it's showing the statistical analysis performed for the same stage. So based on the two questions listed in the online questionnaire about describing the relevancy and the availability of the proposed indicators, two selection criteria were set to determine if an indicator is a globally valid and measurable indicator. So as we can see here on the slide, the first criterion is the relevance of the proposed indicators to measure progress of for each relevant DG from a global perspective. And the second criterion is the availability or the accessibility of these proposed indicators in different countries. The analysis of the questionnaire responses was performed using two statistical approach. So this figure here shows the first approach, which is the outliers detection using the box plot examination to identify the not relevant indicators. And the analysis resulted in the exclusion of 10 indicators from the initially proposed list, from the 165 indicators. Now, if you move to the next figure, this figure demonstrates the second approach, which was done by setting or establishing three evidence-based thresholds to indicate the level of usability or the level of performance of these indicators. So as illustrated here in this diagram, for example, if the availability of an indicator is above or equal 60%, it's classified as a usable indicator. If the availability is between 40 to 59%, it's classified as a problematic indicator. And if the availability is below 40%, it's classified as a not usable or rejected indicator. Only the relevant indicators which passed the first criterion were used and compared with the country responses to ensure that the indicator availability accessibility in order to meet the second criterion. And the analysis of this stage generated 109 usable indicators ready to be tested after meeting both criteria, also generated 40 problematic indicators to be reviewed later, and finally 16 indicators that were rejected. If we move now to the final slide. Yeah, in this slide, I will point out the resulting key outcomes. So first, the main outcome is a set of correlated and validated transnational evidence-based indicators that will monitor development goals progress worldwide and support countries in the process of their pharmacy advancement and transformation. The second point is that the final list of development goals was presented in the 21 development goals and across the three DGs elements, workforce, education, practice, and science, with one indicator under each development goal at least. It's also worth mentioning that some DGs, particularly the ones you can see here on the slide, DG 11 impact and outcomes, DG 12 pharmacy intelligence, and DG 20 digital health, have only one or two indicators under the final usable or the final approved list. However, the questionnaire analysis showed that the initially proposed indicators of these goals were relevant to the context of these development goals. They met the first criterion of a measurable global indicators in terms of relevancy, but didn't meet the second criterion, the availability and accessibility assessment, in the respondent countries. But I think we can say here, or we can agree that although data and intelligence, the focus areas of these development goals are considered new emerging areas and show rapid growth in the healthcare field, the existence of national strategies and systems of implementations is still relatively limited. And then a lack of measures to monitor service impact and health outcomes is expected. Now, finally, the developed list of indicators was also clustered into 5 categories to present the developed DG indicators as a second dimension. So we have capacity type indicators where data is expressed as numbers, like the number of pharmacy or pharmacists, etc. And we also have impact type indicators to measure the impact and health outcomes of the pharmaceutical services provided. We also have pharmaceutical services and facilities indicators, which focus on the availability of the pharmaceutical services, facilities, and infrastructures needed. We also have policies and regulatory systems type indicators, which focus on regulation and strategies as drivers to shape the structure of the needed system in order to improve the healthcare outcomes. Finally, we have training and professional development type indicators, which focus on developing competencies and skills across all sectors and career stages. This was a short overview of how the Global FIP Development Goals indicator were developed as evidence-driven global developmental work using research method to support tracking progress toward the FIP Development Goals. Thank you all for your listening, and I will hand it over back again to my colleague, Sherly. She will take you through the project next step. Sherly, the floor is yours. Thank you.
Thank you very much, Diala, for a very insightful presentation related to the development of the DG indicators itself. In the next few slides, I will go through the next step of the indicators. So as what we have heard from Diala previously, this globally validated list of indicators across all development goals will monitor progress worldwide and support each country in the process of transformation of their workforce, education, practice, and pharmaceutical science. So our next step to support the implementation of this indicator will be the following. So we are currently developing a tool for selecting indicators and a monitoring and evaluation framework. The framework will then enable the design of global atlas dashboard, which will drive and inform the progress towards the development goals. In this slide, you will see the aim and objectives of a DG's indicator framework. So the aim is basically to support tracking progress of pharmacy practice, workforce education, and science element of development goals at a national or member organization level. We have three specific objectives, which is to support our member organization to track and monitor progress towards the development goals. Secondly, to align the DG monitoring with existing member organizations or national monitoring frameworks in order to synergize globally comparable progress monitoring and improvement efforts to address data gaps and also to minimize reporting burdens. And finally, it is to enable global tracking of the progress of member organizations and stakeholders towards the development goals. And hopefully this can assist a multinational review of aggregated data. In this slide, you will see the intended benefits of the framework. We hope that in general, the DG indicator framework will synergize global, regional, and national monitoring effort and will provide the following benefits. So the first is the framework of indicators can help member organizations to tailor to their specific context to monitor the progress against the development goals. And the framework will reduce the variability across nations monitoring. And thirdly, it will provide guidance on area that perhaps it is not traditionally measured by member organizations or nations. In this slide, you will see our proposed process for tracking the development goals. So first, we need to select the development goals to be tracked. And we can select this by prioritizing the DG according to our needs and priorities. We can identify a broad area where there are like active ongoing national policies or project mapped to FIP development goals. And we can identify, like, for example, the top 5 priorities mapped to the FIP development goals. So after we select the development goals, then we select the right indicator. How can we select the right indicator? We can reflect on the usefulness of the indicator, which is basically the indicator should be useful to provide measurable results, to demonstrate the progress towards the development goals, to identify area that need attention or opportunities for improvement. And indicators should be useful to support the continuous improvement. And after we select the right indicator, we then can develop a monitoring and evaluation framework. And in this slide, you will see the difference between monitoring and evaluation. We can consider specific questions that are needed to answer to track the progress. For example, what is being monitored? Then we can make links to the data sources and how these links can be reported. And finally, it is important to improve continuously. So the Atlas dashboard can be a good instrument for the presentation of this data and to look at the change over time to inform and drive the improvement. This can include overview of a limited set of key indicators to bring attention to those areas that are advancing the profession or experiencing the challenges. So it is important to support this with a regular review of DG progress to improve the data quality. That's in general our proposed process to monitor, evaluate, and continuous the indicators, continuous improving the indicator. So thank you all for listening, and I would like to give the floor back to Chris now.
Thank you, Sherly and Diala, for that really in-depth view of the development goal indicators and the monitoring and evaluation framework that also has been created to take a process through using the development goal indicators. I guess as there are 109 development goal indicators, not time to go through them all today, but hopefully we'll be seeing that framework very soon so people can see what the indicators are about. And it will be things like numbers of pharmacists per 10,000 of population as an example of a capacity indicator for workforce. Great, thank you so much. And now we move on to our panel discussion. And very delighted to have our guests here today. The panel discussion, the aim really is about discussing regional and national priorities related to the development goals and what data and intelligence will be needed to track progress against these priorities. We'll do a brief introduction to our esteemed panelists. Firstly, we have with us John Jackson, who's a member of the FIP Data and Intelligence Commission, who is also president of the Western Pacific Pharmaceutical Forum. And John, I know, works across the Western Pacific to enhance pharmacist practice. He's also director and project pharmacist at Monash University. So welcome to John. I'm also pleased to welcome Leonila Ocampo. He's a member of the FIP Data and Intelligence Commission as well, and also a member of the Western Pacific Pharmaceutical Forum Executive Board, and a member of the FIP Community Pharmacy Section Executive Committee. And finally, last but not least, Dr. Suzanne Caliph, who is a member of the Western Pacific Pharmaceutical Forum and senior lecturer at the Faculty of Pharmacy and Pharmaceutical Sciences. And Suzanne's research interests include graduate and workforce skills development, education technologies, digital health, oral drug delivery, and lymphatic drug targeting. We'll be posting biographies in the chat so you can see the full extent of our panelists' expertise. So we'll start off, and hi everyone, thank you for joining us. We'll start off from taking a bit more of a regional perspective and a question for John. John, we heard Lina talk earlier, and she listed the Western Pacific priorities of the development goals from the work she's been doing, and they were academic capacity, early career training, advanced and specialist development, advancing integrated services, pharmacy intelligence, patient safety, and digital health. So from your perspective, working across the Western Pacific region, do they resonate with you right now as development goal priorities?
Thanks for the question, Chris, and it's great to be here with you and everybody. My first comment is to raise caution about the validity of the data that we've captured through the survey method, because there are 30 odd countries and territories in the Western Pacific region. About 16 of them have pharmacy organisations, and we received input from, I think, 7 countries, 10 organisations from 7 countries. And a quick look at those countries indicate the majority of them are from developed countries of the region. And there is a good number of developing nations of the region for which we haven't got data. So I was very interested to contrast the first, second, third level priorities from the Western Pacific region with those from other regions, but you asked me, does it resonate for me? If I draw on my experience across the region, in practice and in the nature of pharmacy education and the like, I think carefully about how relevant the development goals are. And I see a number of development goals that are really like the foundation. You've got to get those right before you can start building others on top. And I think there are 4 development goals that are a foundation. And this applies in our Western Pacific region, but I suspect it applies globally. The first one is academic capacity. We need the right academic capacity to ensure that our graduates are prepared for what comes next. The second one is competency development, because that will feed into what the academics provide in terms of education, but it also facilitates further advancement of an individual pharmacist's practice. The third one that I'm going to present is CPD strategies, because once people do leave education, knowledge continues to expand and they need to keep up. And so there needs to be a strategy for them to keep up. So I think that's the third foundation, a good CPD strategy. And of course, none of this happens without leadership. And so I think leadership is incredibly important. And I was interested to see that leadership, that's number 6, did not get a high ranking in the Western Pacific region, I'm sorry to say. And on reflecting, it might be because we got answers from leaders and they don't perhaps recognize the need to build capacity of leadership in the rest of the profession. So for me, Chris, the 4 that I'd start with are the academic capacity, the competency development, the CPD strategies and leadership. And I'm really pleased to see that at least academic capacity ended up in the first tier in the Western Pacific region, 2 ended up in the second tier, and 1 ended up in the third tier. So that's a bit of an introductory oversight of what I think is relevant in the region.
Thank you so much, John. So there's a fair bit of alignment there. And I guess as people are engaging and using the development goals, their priorities may well change. I was interested to hear what you said about leadership, because as you say, it might be that they just think that's a bit of a given as they are the leaders. So thank you. If I move on just to take more of a national perspective with Leonila and Suzanne, and really ask them from their perspective what they see as, from their nations, what their priorities are with respect to the development goals or closely related priorities. If I start with Leonila, what would be your perspective on this?
Thank you, Chris.
National priorities.
Yeah, thank you, Chris. In my perspective, talking about what are the priorities among the development goals that we have just enumerated for my country, I have listed number 1, leadership development, because I always would believe that if the leader is prepared to really take the lead in doing things that we would want to happen, then planning could be done very well, and definitely outcomes could be identified also well. And then the number 2, which was mentioned already by John, is competency development. We cannot do anything without the competencies that we should have as the practicing professionals that are expected to deliver certain outcomes to the clients that we're serving. And then I haven't anymore listed academic capacity, and Jan have mentioned that. Another one is on pharmacy intelligence. I find that very important because we had been in the country doing a lot of researches, but how to use the data collected, so and how it could be applied and operationalized is something that needs to be also given attention to. And we need to let our pharmacists here also understand how important data is to support any initiative that we will do, and to support also, or to be utilized as a tool, especially when we're trying to negotiate for something in behalf of the organization or the profession. And then number 4, I've identified only actually 4, is access to medicines, devices, and services. Maybe I'm saying this given how my country is, the challenges that we are experiencing, how people could have that equity and equality in terms of accessing their medicines, devices, and services in the country. So all of this, all others are things that we find also important, but I found all of this to be taken as priority of what we need to do. Why I've listed leadership as one, because this is one big challenge when there is something that we would want to embark on or to work on, that without the effective leader on top, then things would just be coming out not without getting the outcome that we envision to have. So these are what we need actually in the country.
Thanks, Leonila, giving us some of your priorities from the perspective of the Philippines and your context and challenges. I'm going to move swiftly to Suzanne and ask for priorities from the perspective of Australia and what you think the priorities are.
Thanks, Chris. Well, there are 7 DGs listed as the first level priorities in the Western Pacific, and I was very pleased to see the top 2 priorities as an academic capacity, and which is DG1 and DG2, early career training strategy. So I'd like to make some comments on those 2 priorities. And I was thinking about what sort of questions we should be asking, what sort of data we should be collecting. For example, DG1, academic capacity. Australia has high standard of pharmacy education based on academic expertise, good and fit for purpose facilities, and accreditation of programs. And we have appreciable supply of our initial education and training programs to produce workforce to meet the demands of our national health needs. So we have currently 47 accredited pharmacy programs offered by 20 providers across Australia, including Bachelor of Pharmacy, Bachelor of Pharmacy with Honours, Master of Pharmacy programs. We currently have about 30,000 pharmacists in Australia for the population of 25 million people. So that's about 125 pharmacists for 100,000 people. And we are top 10 amongst the OECD nations. However, I found that about 40% of our workforce are under 35 years old, and recent data showed, compared with 10 years ago, increased proportion of younger pharmacists less than 35 years old do not intend to practice beyond the next 10 years. So the question or the data I like to collect or help FIP to answer is, well, why is that so? Why are our young people leaving the profession? As a nation and as the region, are we investing sufficiently to support our young graduates to advance further in their career? How are we fostering their development? We need our governments to work with our professional bodies and academic institutions to invest more in pharmacy workforce education and training to meet the demands of current and future healthcare needs. Yes, we need government investments in infrastructure and technologies, but investing in a skilled, capable workforce education is also vitally important. So that's my first take on that. And secondly, our DG2, early career training. So in Australia until 2017, there's no nationwide formal training program for early career pharmacists to engage in once they register to practice. In 2017, residency training programs were first launched by the Society of Hospital Pharmacists of Australia, SHPA. in accredited hospital training sites. Currently, there are 44 to support early career hospital pharmacists to transition to expert level in various specialized clinical practice areas that warrants recognition by their peers and public. For many years, peak national professional body, PSA, also had early career pharmacists ECP forums for many years. In recent time, PSA set up forums called communities of specialty interest, or CSIs, to better engage with, especially with younger members, to set the future of the profession. So the CSI ECP forum for CSIs represents students, interns, and registered pharmacists of up to 10 years of experience. And it's good to see that many young pharmacists and our students are joining these forums. They've got mentors, and they've got leadership groups, and on the forum they can discuss for professional development, practice support and advocacy, and also to facilitate programs to improve professional satisfaction of our ECPs. So looking at that, these developments to support our early career pharmacists are fully aligned with the FIP DG number 2 that emphasize the importance of foundation training infrastructures in our profession. And I'm very happy to report that and see that happening and growing in our nation.
Thanks, Suzanne. That's so useful, and to get the Australian perspective, and you've given us a lot of data and intelligence that I wasn't aware of totally. So just showing you the importance of that. And that's a very nice segue into the next question, which is really, what data and intelligence do we need to track progress against the priority development goal priorities? I know, Suzanne, you have to leave us fairly shortly, so I'll take that question to John from a regional perspective. What data intelligence do we need, and are there any gaps with regard to data currently being collected?
Chris, there are definitely gaps, because I'm not sure that we even know what intelligence we need as yet, and there's definitely not a capacity across all countries of the region to collect the type of information that we need. So it leads me to say, what can potentially be collected? It's not just a case of having a wish list of, oh, I'd like to collect this. It's what can be collected. Because if we're going to collect data and make it useful, it's much better to have longitudinal data and track things and report things rather than a snapshot. And so it's got to be easy for people to collect and present data. And if you think about the universities and academic capacity, and I'll go back to that one because it was a priority listed in the survey, and I do believe it's one of the building blocks. There are some core pieces of information that is readily available in universities. How many students have they got coming in? How many students go out successfully? That in a way might be a reflection of academic capacity. But of course, to get out successfully, there's got to be some kind of assessment that's going on of those students. So is there an ability to create some common set of assessments that are used across the region to get an understanding of the caliber of students and use that as an indicator of academic capacity? Again, I'm not actually going specifically to an assessment of the academic per se. I'm going to an assessment of the output of the academics, the number of students, the success of students, and a comparison of that across different countries. So these are things that I think the universities would be interested in. And I think it's something that we could build as an easily reported mechanism across the countries of our region. Now, the difficulty we do have is that the nature of the education for pharmacists in any one region, in any one country, is aligned with the nature of practice in the country. So if a country still has a strong drug manufacturing capacity. A lot more of the academic focus is on the manufacturing process. Whereas if a country doesn't have the same level of manufacture, but does a lot of importing, their focus may well be much in the academic area, much more on therapeutics. So you'd actually have to address the difference in the nature of the academic programs in the various universities in the various countries. But there's an example of what we could potentially monitor as indicators in that one particular DG academic capacity.
Thank you so much, John. That's very useful to hear, and I guess it all needs to be contextualized nationally, the data collection. Suzanne, was there anything you wanted to add from what you were saying earlier about you listed quite a lot of useful data from Australia? Is there anything else you think that's needed? Any particular gaps, briefly? You're on mute, Suzanne.
Sorry, Chris. So another top level or first level priority that's listed for the Western Pacific region is advancing integrated services. So that's another area that we could look at, in particular, what policies or strategies are needed for strengthening and transforming pharmacy workforce education and systematic training of trainers and educators. So that's the other question that I'd like to answer.
Great, thank you so much. And finally, Leonila, I know you've done a lot of data collection in your work over the years, but what do you think is currently needed and what are the gaps?
Thank you, Chris. Actually, I would agree with what John and Suzanne had happened. It is important for us to understand what data can and should be collected if there is something that we would want to lobby for or to work on. And another thing also to be answered there is how should it be collected and who should be the one providing the data, so that we would have one that could more or less be something that is meaningful data being collected. Then these are what we really need, because to be convincing, especially with what Susan need, that we need to also look at what strategies to use and what policies have to be put in place. It's important that we will be equipped with the data as a tool when we start negotiating with anybody who may have the authority to have that policy be developed and published out. So I would always want to say that it's important we know what we want, what particular development goal we would want to work on, and then take a look at what data could we collect and how should it be collected, so that we would be able to successfully get the outcome of whatever is there that we've identified to start working on, and identify also who should be or how providing those data.
Chris, if I just come back in on that, and if we do have time, because I know we're running against time, there are obviously some indicators that can be quantified numerically, and that makes it so much easier to monitor. I mean, I think of things like CPD, attendance at CPD events as a ratio of the total membership of the profession would be a type of indicator. In some countries, it's compulsory to do CPD, and so there is built into those countries a process of tracking and reporting attendance at CPD, and we should use those kinds of already existing processes. So, you know, you could measure as an indicator the attendance of CPD, or if you're talking about aspects of early careers, retention in the profession. Suzanne mentioned the loss from the profession and the indication from young pharmacists they don't intend to stay as long as older members of the profession have stayed. You know, we could track retention at the 5-year mark and 10-year mark and that would be a surrogate indicator of how successful we've been at career development. I said a building block is leadership, but I honestly do not know how you measure leadership.
Yes.
It's not something I can quantify. So I would love to see what Sherly and Diala come up with as indicators for such a thing as leadership.
Thank you, John. And yes, some development goals far more difficult to monitor progress with than others. And I think that's a very useful point to finish on. I'd like to thank all of our panelists for their insights and expertise in this area. And I think we've actually learned a huge amount from what you've been saying. Thank you so much for joining us today. Okay.
Thanks, everybody. It's been a pleasure.
Thank you, Chris.
Thank you.
Thank you.
So now it's my task just to provide some wrapping up and conclusions from today's event. You've heard about the work of the Global Pharmaceutical Observatory and the Data and Intelligence Commission. And then that took us into the development goal priorities that Lina presented from a global, regional and national perspective across the Western Pacific region. And then we had a really in-depth look at the creation of the development goal indicators from Sherly and Diala, and how we will be taking that work forward very shortly. And obviously, as I mentioned, the great insights and expertise of our panelists on the priorities of the development goals and how to measure them. If you want to know any more about the Global Pharmaceutical Observatory, our microsite is shown on the screen now. The address is there. And if you want to know anything more about the events that FIP are running, they are in the events.fip.org website. You can also find previous recordings there. Finally, I'd like to thank all our speakers for their wonderful presentations, and again, our panelists for their expertise and insights. And thank you all so much for attending, and I wish you a good day, a good evening, a good night, wherever you are. Thank you so much.
Thank you and stay safe.
Thank you. Thank you.
Thank
you all. Bye-bye.